Dr. Gilbert, thank you for joining us.
Pleasure. Thanks very much, Mark. It's a delight to be here. Thank you very much for CRPD. It's good to get together. It's been a while. And congratulations on your ongoing great work. I want to talk today, as per the title, on psychological health and safety, a little bit about me and my background. I'm a clinical psychologist, been practicing for a long, long time. My areas of practice are odd in some ways, but actually come together. I work in the area of child and youth mental health at Children's Hospital, and I, as the last number of years, working in workplace mental health through Simon Fraser. And it seemed like very disparate areas, but my standard line, and only partially tongue-in-cheek, is the difference between the schoolyard and the workplace is not that big. So they actually inform one another. Was also some years ago, I currently work at Children's Hospital. Some years ago, I worked at the institution up the street at PGH, Vancouver Hospital, and so on. I was head of psychology in those days when there were departments of psychology and the like. And that really did inform my interest in this area. I had great colleagues, great team. However, of course, a number of years, a couple of my colleagues, very skilled psychologists, were struggling at work. There were some concerns, performance issues, complaints, problems. Tried to work it out and so on, and things would be okay for a while, but they got worse. And these two individuals ultimately went off work with what was, and we had good enough relationships so that they did tell me what was going on for them, some combination of depression and chronic fatigue. And I don't know if they ever worked again. And it was a real tragedy. These are very, very skilled, talented people, and it was a tough situation for many people, and I think we could have done better. I think I'm not trying to beat myself up in that, but the system failed in many ways for everybody. So that really did spark a lot of my interest in this area. So at present, as I said, I work at Children's. I also have a consulting company with a colleague in Calgary working sort of in this area, in the area of psychological health and safety. And I also, and in particular for my talk today, work with some colleagues at CARMHA, the Center for Applied Research in Mental Health and Addictions, doing a variety of work, but in this context, workplace mental health.
Try the mouse.
Okay. No mouse. Okay. Let's try this one for advancing. No, we're not advancing. We're not making any progress. Okay.
Just keep it on the far side.
Okay. We'll back it up a little.
Oh, you'll need to move it to the other side of the screen.
Sorry, okay. We'll get there, folks. What I want to talk about today is a little bit about the Mental Health Commission of Canada, who commissioned this work, about workplace psychological health and safety, what the concept means, why it matters. And in particular, I'm going to focus on this product, this thing that we produced called Psychological Health and Safety, a guide for employers. And I really want to encourage anyone, any organization, individuals, and so on, to use the guide. It's wonderful to create reports, but the important thing is that people use them. So I'd really like to talk about that. Sorry, I'm having a hard time going forward. Okay. As I mentioned, this was commissioned by the Mental Health Commission of Canada. People who may not be familiar with the commission, it was formed at this point about 6 years ago out of a report from Senator Michael Kirby called Out of the Shadows. It was a Senate report. And on the basis of that, the Mental Health Commission of Canada was formed and funded for 10 years, a significant amount of money, with a primary mandate of enhancing awareness, and knowledge, and so on, not service provision around mental health. There are a number of advisory committees in the Mental Health Commission of Canada, one of which is workforce mental health. So under that, the auspices of the Workforce Advisory Committee, they have commissioned a variety of projects, including this work. But I certainly want to acknowledge the commission in this important area. So we get right away. Something else the commission is doing, which is a potentially very, very big deal. We'll see if it happens, and literally should be happening any day now. The commission, working with Health Canada and working with Canadian Standards Association and the Bureau National de Quebec, are launching, and right here it says late summer 2012, latest date I've heard is early December, but a national standard for psychological health and safety in the workplace. This will be a voluntary standard, at least initially, but potentially a very, very big deal. It's the first time this has existed in the country. So it'll be very intriguing to see what the uptake will be and what organizations do with it. There's a lot of buzz around this, and a lot of work has gone into it. It's intended to support both employers and employees by enhancing policy programs and so on in order to create productive and safe and healthy workplaces from a psychological perspective. In this context, CARMHA was asked, as I mentioned, by the Workforce Advisory Committee to identify some best practice for improving psychological health and safety in the workplace. So we've looked at the literature, such as a variety of different models, both organizational interventions, individual interventions across the whole spectrum of the workplace, various models from England, Australia, the US, and Canada as well, in terms of moving forward, because we do need an integrated approach to this. Right now, the approach to this subject is often very piecemeal. It happens in terms of the introduction of an EVAP, which is great, but that doesn't happen anywhere. That isn't connected with other initiatives in the organization. So we really do need to have an integrated approach. So I want to talk about the concept we are very intentionally using is psychological health and safety. We're not the initial auspices of Mental Health Commission in Canada talk about mental health. We're very deliberately talking about psychological health and safety. There's a variety of reasons for that. One of them may be the fact we're psychologists. If we were podiatrists, maybe we'd be talking about having comfortable footwear, but we're not. But there are some more serious reasons why we're talking about psychological health. Try as we might, when we talk mental health, we want to talk the full spectrum of mental health and mental health promotion. Many people automatically go to mental illness. When we say mental health, the tendency is to think about mental illness. And when people think about mental illness, they think often about the serious and persistent mental illness, which is obviously a very, very significant issue, but it's not the issue that impacts the workplace to a big degree. The main kind of mental health conditions that show up in the workplace are typically anxiety, depression, risky drinking, substance issues, and so on. The other problem with that is we end up talking about specific diagnoses in that sense, rather than the continuum of psychological health. And it's important, in our opinion, to talk about that broad spectrum. Everyone has psychological health in varying degrees. Everyone has worries. They may not have an anxiety disorder. People get down, have low mood. They may not be clinically depressed. So we really did want to embrace that broad spectrum of health. The other thing, whoops, let's bring it right direction. The other thing we're very, very intentionally doing is latching on to the occupational health and safety movement. Over the last number of decades, there have been considerable advances, as certainly this audience is well aware, in the area of occupational health and safety. We've got a ways to go, a long ways to go, but it's reasonably well entrenched. There are wellness committees, safety committees, there's legislation, there's regulations, there's expectations. So what we really want to do is latch on to that notion of occupational health and safety and broaden it to include psychological health and safety. What the Commission is doing with the standard is a reflection of that. Bill 14 in British Columbia is very, very interesting. It is a movement certainly in that direction. In fact, the psychological injuries will be covered to some degree under the new WorkSafe. Ontario has Bill 168, which is focused on bullying and harassment kind of legislation. Quebec was the first jurisdiction in North America to have legislation again around bullying and harassment. So increasingly we're seeing kind of regulatory movements in Canada, in North America, and frankly around the world, where we're seeing a broader spectrum to include psychological conditions. It raises a rather interesting, if you will, philosophical issue. Truly, we want to embrace a broad context of health. Health, in an ideal world, will include physical health, psychological health, spiritual health. We want the totality of that sense of health. And that's a wonderful thing to aspire towards, but we're not there in any sense at this point. So at this point, we would argue that we want to kind of keep psychological health, not so in box, link it, but really keep that focus on psychological health. So I want to talk a little bit about a psychologically healthy and safe workplace as kind of the goal, the ideal. What does that look like? Well, it's a place that employees have psychological well-being and are performing well. It has to be linked with organizational objectives, strategic objectives as well. It's a place where there are opportunities for people who work there to develop their skills and knowledge, to be matched properly to the right job, have the psychological job fit, psychological competencies to do the work they need to do, as well as the physical and knowledge competencies. It promotes respectful interactions between staff, customers, and the public, that people work together, a respectful workplace. And it does have things in place to support staff who may have some degree of difficulties. I was at a presentation a couple of weeks ago and one of the presenters was OPG, the Ontario Power, I forget what the G is, but essentially it's BC Hydro for Ontario. The chief medical officer very proudly announced that they had just expanded their benefits coverage for seeing psychologists to $5,000 a year. That's significant, very significant. The healthcare system here in BC only recently has started to include coverage of psychologists under their benefits plan. So as I still work in the healthcare system, only this year can I actually see myself, which is a little bit sad. This is sort of a bit of a, I mean, I think this is legitimate, but it's a bit of a dry description of psychological health workplace. I would argue that any of us would know a psychologically healthy workplace when we walk in, be we the public, be we customers, be we clients, be we employees in that sense. There's something in the air. I won't use any names, but there's a grocery store, a big chain close to me, and so on. And the people in there are miserable. They're very, very grumpy in that sense. You can tell they're not happy people. Yes, they will say to me, would you like help out with that, Mr. Gilbert? That's nice. And then and literally, the next breath is, can I take my break now? It's really not a happy place to work. I think it's a healthy place to work. And as a customer, I don't want to go there, and I avoid that. So I'm sort of making the argument that there actually is a business case, a place where people want to be is a place that customers want to be as well. Oops, right direction. Okay. So that brings up a key point. Why should organizations, businesses pay attention to this issue? These are tough economic times. Organizations, businesses, public and private, small and large, have a lot on their plate right now. And there's a tendency, certainly, I can understand it, for an organization to say, yeah, this stuff is nice, but right now I'm concerned with keeping our corporate head above water, as it were. Legitimate point. However, there is a very, very strong economic argument for paying attention to these issues. Carolyn Duroy out of Toronto has estimated the cost of mental health conditions in the Canadian economy at $53 billion a year. There's a tendency in Canada, and I'm waving a flag about universal health care, but there's a tendency in Canada to say, okay, great, we'll refer off to the healthcare system. I'm sorry, folks, the healthcare system, in my opinion, is ill-equipped and ill-prepared to deal with workplace mental health. The employers are paying the tab right now through benefits utilization, through absenteeism, through presenteeism, through grievances, through replacement costs as well. So there is an economic impact. And some organizations, certainly, well, the healthcare organization, the healthcare in BC, the leading cause of disability in healthcare these days is depression. It used to be MSK. I find that very interesting in a sense. There's also a legal argument for paying attention to this issue. I've mentioned already the upcoming standard, as well as Bill 14 in BC. Increasingly, the courts are also looking at employers and organizations in terms of accommodations and the kind of workplace climate they're creating in terms of their attention to the psychological health and well-being of their employees. So increasingly, there are rulings coming down on organizations saying you need to do this. In the United Kingdom, the Health and Safety Executive has had legislation, so-called stress standards, for a number of years. And that legislation includes the right to impose a heavy fine or jail time to management, to organizations that don't adhere to these particular management standards, continue to create and keep an unsafe workplace. So that's the stick side of things. You need to pay attention to that. There's also a pragmatic reason to pay attention to these issues. Quite simply, it's hard to be effective if half your employees are struggling with any kind of physical or mental health condition. It really does make, as I said, good business sense in that as well. And certainly a number of organizations, there have been a number of great organizations here in BC that have recognized the importance of this issue and seen it just as the right thing to do. Indeed, I was talking to someone a while ago who had worked in the U.S., and his observation, which I found intriguing, was those organizations are really paying attention to mental health, psychological health in the workplace, are those where the leaders have either personally been touched by mental health issues in their family, friends, or someone around them, or have come from the U.S. where under behavioral benefits they actually see the real costs. As I mentioned, there's a bit of a tendency to say, great, we'll defer this off to the healthcare system, and I don't think we appreciate that. In terms of the personal aspect of things, and I will name names, Lloyd Craig, formerly of Coast Capital, CEO of Coast Capital, has been a very major figure within BC in advancing the cause of workplace mental health. And Lloyd and Heather Craig's son suicided. So it's that personal issue. Michael Wilson, former ambassador and Minister of Finance, similar, had a death in the family due to suicide, has been a major, major advocate in this area. So people come to this issue, organizations come to this issue for a whole bunch of different paths. And I think it is important, if an organization is going to take on this issue, they be clear for themselves why it matters to them. Because the business case for a public sector hospital in terms of addressing this issue is going to be different than a small private enterprise. A unionized setting versus a non-unionized setting will each have different needs and issues that they should pay attention to. So one of our points in the guide and so on is really encouraging organizations to develop a specific business case, a specific plan that works for them. So more and more there are organizations who kind of get this. They're looking at their bottom line, they're looking at their costs, they're looking at their turnover, grievances, they're looking at the climate, they're looking at feedback from their own employees and from customers and clients saying, okay, we get it. We need to do something, but we don't know what. We don't know where to start. This is a big issue. How do we tackle it? And a choice, you can do nothing. That is always an option, but this issue is not going away. I strongly, strongly believe this is not just the flavor of the month. This has been brewing for some period of time and it's continuing to get bigger and bigger and bigger as an issue. So I would argue very, very strongly, and I think the data supports this, that we really do collectively and organizationally need to pay attention to these issues. So it was under those auspices, the desire to help employers do something, that we created the guide, Psychological Health and Safety, an action guide for employers. Somewhere down here I have it. There's a hard copy guide. It's in French and English. It's a free download. As both an ebook and as a hard copy PDF available to anyone at multiple sites. It's primarily available to the Mental Health Commission, but we're also going to post it to CARMHA and encouraging anyone else to cross-post. So I hope the CRPD will make it available to people as well. That says we really do want to get it out there. So before we started, when we looked at these different approaches to mental health in the workplace, they were, as I said, very fragmented. And we really recognized the need to have kind of a model or framework before we started. So what we did was come up with the P6 model. This was the hardest piece of the work, is to have each aspect of the framework start with the letter P. The rest of it was easy. Content came easily and so on. But we had to come up with P's. So it's the P6 model. You have to have a good acronym. Everything else follows. So I want to spend a little bit of time talking about what that means. This one is a bit of a stretch, but the first step, and this is a little bit like a quality improvement circle. They're all feeding each other. The sort of first step is what we're calling policy, which really means leadership. You're not going to make any progress in this area unless there really is a strong commitment within your organization to do something. I have worked with organizations in the past, and I think have been very well intentioned, but this gets assigned to a relatively, perhaps junior person, HR, to do off the side of his or her desk. It's not going to work. Nothing's really going to work very effectively that way. And that's not just, the outcome isn't just that, oh, it didn't work. The outcome can be much worse than that, and it creates a sense of cynicism. We can't do anything. Employees get burnt out and say, that kind of company doesn't really care, doesn't matter. So it is key to get that leadership, ideally from as far up in the organization as possible. Senior leadership making a public commitment that this really matters to it, making that statement as to why it matters, tying it in with strategic objectives within the organization, and building that leadership within a team. In unionized setting, ideally a joint statement from labor and management saying that we're going to work together on this, and finding those key individuals within the organization. What we talk is building an action team that are actually carry this stuff forward. And giving those folks the resources, which may mean money, but certainly does mean the time and meaningful support to actually go forward. The next thing we think is key is what we call planning, more P's, and as the name implies, basically get your data together. Figure out what your key indicators are across the organization to know what you're aiming for. You can't make improvements in something unless you know where you start. So there's a number of ways of gathering that data. You can look at a lot of your own data. You can look at health and safety data. You can look at financial data and so on. One example is also survey employees. Ask the people who work there who are the best experts on the workplace, where they're living and working. Once you've done that, you can start to move forward. And we do talk about this kind of classic or the standard approach to intervention, so on, promotion, and then primary, secondary, and tertiary prevention. So in this context, we're talking about mental health or psychological health promotion. And certainly, again, it's nice to have that, back to my comment about the continuum of psychological health and safety. We also want to talk about building the strengths and capacities and skills that people already have. So psychological health promotion in this context is providing them with tools and information to make healthy, psychologically healthy people even healthier or maintain their health. After that, we move into talking about, as I said, the 3 levels of prevention. First being primary prevention, so those changes in the organization, I lost it, okay, that may contribute to psychological health problems, thus reducing the likelihood that those problems will occur in the first place. So classic example of that might be providing stress management training. At secondary level, you want to move in and identify those individuals, those employees who may be struggling to some degree, but as yet have not either been diagnosed or manifesting difficulties that would justify an actual diagnosis. So providing support for those folks in an early stage so you can reduce the likelihood of more serious problems and equally, if not more important, actual disability. It's worth bearing in mind that the majority of folks with mental health concerns in the workplace are at work. By estimates for depression, about 2/3 of people with depression while work are at work. They're not off work. So there's a bit of this notion that everybody goes off on LTD. Some do, but there's a bunch of folks at work. We really need to support those people at work. Moving on, there are those individuals and so on who are going to have diagnosed mental health problems. We need to provide appropriate supports for those folks. Again, paying attention to providing rehab and treatment that may keep them at work or will get them back to work as quickly as possible in a safe and productive manner. So those are the interventions, but you also need to figure out if they work. So we talk about the sort of next step is process, evaluating whether or not you actually made a difference. So back to that initial point in terms of gathering data, what are your key goals, key indicators? Did they make a difference? What doesn't get measured doesn't get done. And that means not just looking at the outcome measurement, actually look at the implementation process. I worked with a company a number of years ago, good company in Alberta, who had a grievance against them around harassment. And it turned out to be a kind of branch company of a large American company. And the home office in the U.S. said, you guys really dodged a bullet in this one. If that particular grievance had come up in the U.S. court system, you would have been fined a massive amount of money. And these guys were surprised because they were very proud of this harassment policy and procedure they had in place. And it was a good one on paper. It was a great policy, but they hadn't implemented it. They hadn't trained people. They hadn't informed people about it. So it was a good process on paper, good policy on paper. It just hadn't been implemented. So it's important to look at the implementation of programs, not just the outcome. Finally, persistence or sustainability. Many organizations will do these one-off kind of initiatives. Let's see, last week we did a stress management talk, or we paid some attention to, well, any health condition and so on. Great, let's move on this year to something else and so on. And it doesn't work. So really looking at sustainability, look at where your successes are and maintaining them. Look at where things may not be working so well and what can you fix. So really having that kind of quality improvement cycle and so on so you can keep moving forward. So within the guide, within each one of these Ps, each one of these components of the framework, we have a set of actions for each one that an employer can use in each one of those domains. The actions we picked are all evidence consistent. So where there's a literature out there or even the gray literature about good practices out there, they are practical, so they're intended to be things that are easily implemented by any organization, not terribly abstract. They can be, in many cases, they're free. So on. They will take an effort in terms of time and energy, but we've provided links and information as to some free guides and tools that are out there. And they can be done on their own. We really want the guide. We want this thing not to be treated as a book. We want people to rip it apart. We want people to look at the components and the pieces that may be relevant for them and their organization and use them. One of the comments that comes up a lot, and it's a fair comment, is small employers. Small employers say, well, this is great if it's the Bank of Montreal. You can do this stuff because you have a big corporate infrastructure and so on. What about the small business, which are the backbone of the Canadian economy? We do have a section here on how small businesses can apply these tools and can use them. And as I said, many of them are free, and frankly, I think a lot of small businesses have the opportunity to be more nimble and flexible than a lot of big organizations. In many cases, if someone is struggling in the workplace, in small business, the manager, the person in charge, is closer to the ground and more likely to be able to actually see if someone's having a hard time. In the healthcare system, for example, there are managers with a scope responsibility of 50 to 100 people, some of whom they may never have met. So I actually think small businesses, in some ways, have some challenges, but they also have some opportunities. We've also provided appropriate references, resources. We've got stories to kind of illustrate how people would use some of these actions, how they would apply them in their particular workplace. And we have further information that people can follow up. So for each one of the actions, and again, one of our other challenges was every action has to fit on one page. So it was really trying to actually pare it down as much as possible. As I said, to kind of pull this thing apart so people can find the tools here as things they can actually use. So for each action, we talk about what it is, what we mean by it, why it matters, why it makes a difference, and then how to implement it with a couple of practical tools. So what I'd like to do now is give some examples of some of the kind of tools that we have in the organization, in the guide, some of the action we suggest. As I mentioned, one of the key ones is really getting endorsement from organizational leaders. That really matters. The why it matters and so on is a statement, public statement, that this organization cares about its employees, cares about the well-being of the people who work there, and is going to follow through on doing something. This is going to be done, something that's going to be done as a one-off, and then we're going to move on. And this is going to be a challenging one, quite frankly, because many of these initiatives happen within human resources, and human resources can be a relatively weak player at the corporate table. So it really does matter to try and get it as far up in the organization as possible and make that commitment. I worked with one organization, they'll go nameless, and I think there were good intentions. They really did want to take something forward, but they did pass it off to a fairly junior HR person who didn't really have a vision, and this wasn't her fault, but there really wasn't the endorsement there within the organization itself. And they had a number of meetings, but they never did anything. So really having that commitment up top. So some kind of a statement, some kind of a letter, some kind of documentation in various kind of newsletters or web connections, intranet connections, that this is something that matters to our organization, this is why it matters, this is what we're going to do about it, and a commitment to follow through. Another example of an action is to survey employees. As I mentioned, employees are the experts within the organization of what the climate is. This area is sort of an interesting one in the sense that we cannot say that any specific aspect of the organization causes a specific mental health condition. We do not know definitively the cause of almost any mental health condition. There may be biogenetic factors, there may be environmental factors, but we don't know specifically for an individual. What we do know, however, is that mediating variable stress can contribute to the onset and the exacerbation of a mental health condition or psychological health condition. And stress is often where the focus of these interventions is. So stress is kind of a key variable, looking at the workplace environment, which may be very supportive to someone who's struggling or may be a significant stressor. Indeed, what many organizations will report or managers will report is that employee may have been having a difficult time, there have been some performance issues. They tried to speak to them about the performance issues. The next thing they knew, the employee was off on stress leave, and there was a note from the doctor saying that they'd be off for 6 months. There's something wrong with that scenario. It's not working well. So one of the things we developed under separate auspices is something called Guarding Minds at Work. I'm curious, has anyone heard of Guarding Minds at Work? Okay, okay, great. Guarding Minds at Work is, we know what a health risk assessment is for an individual. It's an organizational risk assessment. So it's an organization asking itself, asking its employees about the health status, psychological health status within the organization, looking at specific risk factors. At this point, we just revised it from 12 risk factors to 13 risk factors, and frankly, we did that to fit more consistently with the standard that's coming out, because Guarding Minds is one of the recommended tools within the national standard. So really looking at a bunch of risks within the organization and supportive factors in the organization and how employees are seeing them. So Guarding Minds consists of a free online employee survey that can be administered. It consists of a brief assessment survey that can be administered to all employees, a self-assessment component where essentially the organization looks at its own data and so on and assesses its own well-being in that sense, which gives you a snapshot. What gives you the picture on the left here is the report card, which tells you you're doing great. We also, sorry, I should mention one more thing. We were very fortunate and I think unique in a sense in that we took our Guarding Minds survey and worked with Ipsos Reid, who ran it on initially 8,000 working Canadians and more recent updated sample of about 5,000 working Canadians. We're actually comparing it against a normative group of working Canadians. And so the report card you get here is based on that data set. How are your folks doing in comparison with a national standardization sample? That makes us somewhat unique. The Brits have a similar kind of management survey, but they just looked at quartile splits. We actually are looking at it, comparing against a normal distribution or against a normative distribution. So Guarding Minds at Work is, again, free, available for any organization to use. Another action that's really key, and I often spoke about, is enhancing mental health knowledge, or what's called mental health literacy in many ways. Needless to say, one of the factors when we're talking about mental health or psychological health conditions, it does make it somewhat distinct and tough to deal with, is a whole issue of stigma. There's considerable stigma still in many sectors associated with mental health conditions which can be very a major block, major impediment to any progress, including individuals who are very reluctant to, understandably, come forward and talk about some of their struggles for fear that they will be discriminated against, that it will block their future opportunities to grow within their organization, that they will be judged for it and thought poorly, and they're maybe thinking poorly of themselves, kind of self-stigmatization. So one of the things that has been demonstrated to be very effective in combating stigma, quite frankly, is improving mental health literacy. There's some very good programs out there. There's something called Mental Health First Aid, some great work out of Australia and so on, that people actually can talk about this stuff. As I mentioned, I work with kids and young people, and I take a lot of encouragement from the fact that, in my opinion, my experience, young people are much cooler about talking about mental health stuff than other generations in some ways. This is the Kurt Cobain generation and so on. They live this stuff. The separate project, we developed a tool for adolescents called Dealing with Depression, and we talked to these teenagers, well, how should we talk about being depressed? You want us to say you're down, you're feeling bummed out. We use these various things, and they rolled their eyes at us the way teenagers can. No, talk about depression. Call it what it is. So I do see some hope in that, but we do need to change the language. We need to make it more acceptable. It's often pointed out that if someone's off work because perhaps they're having a baby or perhaps they're getting cancer treatment, we send cards, we stay in touch, we connect with them. With mental health, that's often not the case. They're gone in some ways. So we need to turn that around. And one way to do that is providing exposure information within the organization, be they lunch and learns, be they online programs, and so on, so we can raise awareness of these kinds of issues. Another action that we recommend and have done a lot of work in is providing self-care tools, providing practical, usually cognitive behavioral-based tools to help people with self-management. This doesn't mean treat your own depression per se, but it is using basic fundamental CBD principles to help people with problem solving, goal setting, activation, and the like that have been demonstrated quite consistently to help deal with mood and anxiety issues. So along with colleagues, we've developed a number of tools. As I mentioned, we've developed one tool for youth. We've also developed one tool, this one called Antidepressant Skills at Work, which is a self-care guide for working adults dealing with mood issues. There may not be clinical depression per se. They may not be diagnosed dealing with mood issues. They may be receiving treatment, psychological or pharmacological as well. But whatever it may be, this really does focus on some of the issues in a workplace context. An example in here is we actually have sort of a decision tree, not telling people what to do, but pros and cons of taking time off work. I think it's interesting, again, this audience will appreciate this. About a decade ago, if you had a back injury, the recommended treatment was what? Bed rest, typically, right? What is it now? Activation. I think there's some parallels, and I don't want to draw a straight parallel, but in the mental health domain. The go home and I can't pick an Oprah anymore. It's not. I don't know what's on in daytime TV. But go home and watch daytime TV for 6 months is probably not a terribly effective intervention. So helping people stay engaged, stay active, and stay at work if it's safe and productive is a good advice. So things like these self-care tools are help people make those decisions. Another key action that a lot of organizations have adopted, which is great, is through an EFAP, Employee and Family Assistance Program, or Employee Assistance Program. We think EFAPs are great and a good thing to do. The concern that I would have is that there's some organizations will say, great, we have an EFAP, we have all this covered. No, you don't. It's good you have an EFAP. I think that's a key component, especially for early intervention, supporting people and so on. But it is not a one-stop shopping, a comprehensive response to dealing with workplace mental health issues. It's a component, but it needs to be part of a larger framework, larger picture. This one we also think is really, really key. I mean, this is true certainly, again, for this audience in general in providing disability management, particularly in mental health. There tends to be a very, very fragmented approach to mental health in the workplace. Quite frankly, the key person often seems to be the family doc. The family doc is kind of judge, jury, and executioner in many ways. The very common experience, I mentioned, a number of managers will report that the employee went off to see their family doc and described a bunch of issues at work. They felt they were being bullied, they felt that their workload was unreasonable, and they have conflict and so on. And because of that, they're not sleeping, they're worrying, they're really wondering if life's worth it and so on. They're diagnosed typically with depression. Depression often seems to be the proxy diagnosis, and typically put on drugs, which is the normative treatment for depression these days, to take time off work. So the family docs providing the diagnosis, the treatment, then doing the assessment to determine if this person's ready to return to work, all with very bad information about the workplace itself. So we need to do better than that. We actually need to have a more coordinated approach where we bring key players together to use a problem-solving approach to dealing with disability if someone's off work. This worked very successfully in Holland, in Australia as well. We need to incorporate that here. On that note, and again, as psychologists, we've got to say this one, but it's true, we need to improve access to psychological treatments out there. As I mentioned before, up until recently, the healthcare system, there was no coverage under benefits to actually see a psychologist. So we need to improve that. Again, the evidence backs that up. Unfortunately, the healthcare system in Canada is sorely lacking in access to good CBT. So we're suggesting we need to change that. And I talked earlier about OPG in Ontario, who are actually providing very good benefits coverage so people can see psychologists. Something else we think is really important, we've done a bit of work in this area as well, so a recent project is looking at organizational readiness for change. We're all aware of a kind of motivational interviewing approach to dealing with behavior change. We're applying that at an organizational level and asking organizations, okay, great, you're committed or you think you want to do something about mental health in the workplace, wonderful, but are there any barriers or opportunities? Is now a good time? We worked actually in developing this tool called the MORPH, the Measure of Organizational Readiness for Psychological Health. We actually worked with Back in Motion, a great rehab provider and so on, as a pilot study. And we developed this tool, this online survey, asking employees, asking management if they think they're ready to make these changes in a particular way. And what actions or what changes they're ready to do and what they're not. We're pointing out that, and actually in BIM's case, it was a good example. They were certainly committed. They're an admirable organization in this way, but they were going through a lot of merger at that point. There were a number of new BC contracts, so they're going through a lot of change within the organization. That would have been a bad time to introduce a new program, not because it wasn't a good program, not because they weren't committed. They just had some other stuff on their plate. So looking at timing and looking at resources and looking at commitment in terms of readiness to make change. Okay, so rhetorical questions and so on. The guide's available. It's had great uptake. There's been a lot of interest and so on. But as I said, if it sits on a shelf or on a virtual shelf, it's really not going to be of any use to anyone. So the questions we want to ask of organizations, and those of you who are interested, ask of the organizations you're working with, how you folks can respond to the standard when it comes out. Is this something that's going to be adopted? Is this something that's going to be ignored? How are you going to deal with Bill 14? Is it a response out there? Which actions, what are you going to do? Which actions in this or whatever other actions you may take in the area of psychological health are most relevant and feasible for your organization at this point in time with the resources you have available to you. Who needs to be involved? This needs to go beyond just HR, ideally. You need to get in a unionized setting, you need to get labor involved. In a large organization, you need to get CFO, the financial people involved, the operations people involved as well. This extends beyond just a nice little thing to do down here for HR. What resources will it take? It may take some money, it will take some time, and it will certainly take some commitment. And where do you want to start? Where's a good place to kind of kickstart things, get things started? Start small, start realistic. Certainly if you try and take on a whole bunch of things at once, you're more likely to fail. And as I mentioned at the outset, starting something and failing doesn't mean just it didn't work. It can really grab a negative backlash, and people may give up. So last comments, what we've been doing more recently, developed, and we're good at developing acronyms, something called the FAST. So Psychological Health Action Strategy and Tools. So we've been meeting with a couple of organizations and using this readiness measure and sitting down with them to do essentially an expedited strategic planning session. So doing a quick survey of staff, doing a survey with employers, and asking them which actions you think you're ready for and what do you need to make these happen. So in this sense, we worked most recently with a college back in Ontario, St. Lawrence College, and sat down with their managers and with their staff and asked them about various kind of actions. It was very interesting. They disagreed on some of the actions, so the senior management saw some important actions that they wanted to implement. Staff saw some different ones, but they agreed on one thing, and that's what they're taking forward. Training managers, certainly a key intervention we would recommend is to train managers and supervisors within an organization to be more effective in their capacity of responding to mental health issues amongst their staff. So, these issues aren't going away. Estimates of mental health conditions in the Canadian population, usual in the figure is cited is that 1 in 4 people at some point in their lifetime will have a diagnosable mental health condition. Ron Kessler out of Harvard, who does some great epidemiological work, actually did a study a couple of years ago saying 1 in 2 lifetime prevalence. So they're very prevalent. They cost money. They cost money to society. They cost money to individuals. And the burden of human suffering is significant. The guides attempt to provide one way of taking action, move forward within Canadian organizations and so on. So we hope you'll take a look at it and check it out. Okay. I welcome any questions. Should we start with the audience? Any questions in the room?
I'm just wondering, Merv, if you, with the feedback that you've had on the guide, have you learned some things from feedback, and how are you systematically collecting feedback?
Very good question, and I'll...
Could you repeat the question?
Yep. So the query was based on, since the launch of the guide, which was about 8 months ago, what kind of feedback have we had, and what kind of, I would say, changes, but how are we going to respond to that kind of feedback? Yes, certainly the most common question that comes up is from small businesses. This is all well and good for a big business and so on. What can the little guys do? What we're going to try to do, in fact, one of the recommendations here is support a community of practice amongst organizations, small businesses, so people can learn from one another. We also want to develop stories, case studies, but stories. There's some organizations out there that are doing very, very cool things. They don't necessarily frame it as being psychological health promotion, but they are. A good example of that, actually, and I'll give them lots of credit because they deserve it. I've been involved in the past with something called the Psychologically Healthy Workplace Initiative. We give recognition awards to companies for doing cool things. One of our past winners was a place called Brookhaven. Brookhaven's extended care unit in Interior BC. As people may be aware, the healthcare system across Canada runs on overtime. So the issue is a staffing issue as much as anything else. Staffing issues are particularly pronounced in those days when there are school holidays, professional days, because many of the people working within the healthcare system are often women, and often women who are both partners are working or they're single parents. So a day where their kid has to stay home is not a day when they can necessarily go in and work overtime or do an extra shift. So Brookhaven, one of their big challenges was finding staffing on those days when the school holidays. Their recreational therapist came up with an idea. I believe she just had triplets. She said, why don't we develop a program whereby staff can bring their kids to work? Not as a daycare, but they're paired up with a senior. to develop something called the Little Brooks program. Any staff who had a child between, I think it's age 6 and 12, could bring their staff to work. They got some orientation. They were paired up with one of the residents. Think what that's like. I just think it is so, so cool in some ways. Your kid gets to look across the room and perhaps see you working and connect during the day. Many children don't have that opportunity. You get the opportunity to see your kid. He or she is hanging out with Mr. Smith who's telling stories about the Second World War or whatever. It really, really is a win-win-win situation. What does it cost? Nothing. Zero. Was there some pushback? Yes, there's a bit of concern that what about liability issues and so on. The manager in this particular institution, to be highly credited, said, no, we're doing anything. We pushed ahead. And it's now been replicated in several other organizations within the interior. And actually, for this particular practice, the Little Brooks program, we nominated Brookhaven, this organization, to the American Psychological Association. They won an award in D.C. as one of the best practices in the area. So to answer your question a little more, what we'd like to do and are doing sort of anecdotally but want to do more systematically is find those stories, develop the stories, and disseminate them. And in that sense, build up both the knowledge on the ground, as it were, in terms of practices that people are doing, the creativity, and encourage those conversations. Okay. Any other questions, comments from in the room?
In a small business right now, you work in a small business and you see that someone is really struggling.
Yep.
You can tell they're depressed and stressed. What's the number one recommendation you would have to do with that situation?
And what's your role? It depends. Are you a colleague or are you in charge? A manager.
Manager.
Okay. Sure. And yeah, very common question and a good one. Remember, your scope is a manager supervisor. Well, it all depends on relationship to some degree, but your scope as manager supervisor is around performance and behavior at work. So to be able to say, well, here's the kind of key elements of the message. Sorry, repeat the question. What should you do if your manager supervisor sees someone struggling at work? Key elements of the message are you're valued. Your work's been great. You're appreciated. There has to be some statement of acknowledgement. I've noticed whenever the behavior is you're frequently late for work. If you're a nurse, you're making some mistakes and so on. Point out the behavior. Statement that I would like to help you if I can. We may have programs, benefits, and so on. And a statement that this is something we need to pay attention to. I mean, I think you stick to the performance, but it has to be a conversation in that sense of supportive. And to say, let's follow up, whatever I can do. Ideally, what I like to talk about is small A accommodations. What are things you can do on the job to support the person while they're there? As I said, the go off work or go off site, I don't think is necessary or necessarily helpful. Anything else in the room?
One question from online. I think you may have hit on this a little bit, but if you could provide a few examples of psychological issues that are currently at the forefront in various workplaces.
As I mentioned, the three diagnostic groupings and so on that come up most often are depression, anxiety, and sort of substance issues, particularly depression. I think to some extent that's because depression tends to be a bit of a proxy diagnosis. It doesn't necessarily mean there's more depression. Anxiety disorders are actually a more prevalent mental health condition, but they may not be as impairing or disabling in the workplace. If I have a fear of flying and my job doesn't involve flying, I can't actually say I'm disabled at work in that sense, but depression is more pervasive.
Okay.
Anything else?
That's it for online. Yeah, I think she's happy.
Okay. Any other comments from the room? Otherwise, thank you very much, folks. True pleasure to be here.
Thank you.